Greetings. My name is Kimberly Ross, and I am the Digital Health Literacy Coordinator for Eastern Illinois University, representing Booth Library, the Department of Public Health and Nutrition, and the School of Communication and Journalism. Today's topic, Barriers to Digital Health Literacy, is one of a series regarding enhancing digital health literacy in your facility and in your community. The digital divide is real. Although the United States is a world leader of advanced internet services and technologies, the benefits of these technologies do not reach all Americans, and a digital divide remains, particularly among older adults, less educated, and less affluent populations, as well as in rural parts of the country. The more we use these digital devices, the more practiced and competent we can become. Libraries play a key role in providing access and information to those left behind because of the digital divide. Developing digital health literacy skills is important because patients with low health literacy skills are more likely to visit emergency rooms, have more hospital stays, and are less likely to follow instructions and treatment plans, and have a higher overall mortality rate than patrons with good health literacy skills. Using a website search function can be challenging for people with limited literacy skills. Thinking of words to search and typing search terms using decent spelling can be difficult for many. Some search engines help spelling better than others. As a result, patrons with low digital health literacy skills tend to spend more time on searching things. They give up more quickly. They have difficulty picking the search words to use. They underutilize the search results once the results are found, and they tend to go with the first results only. Being able to recognize the signs of patrons with low digital skills can help patrons at the right level needed and help them find the correct information. Indicators and clues of limited digital literacy are that the patron can become easily distracted by web page extras such as advertisements, links to click on, and surveys that pop up and lead you to different websites. Patrons with limited digital literacy skills navigate web pages in a linear fashion and often backtrack. When they do find acceptable search results, they often choose the first answers without cross-referencing the information for validity. They also have trouble recovering from their mistakes, leading to frustration. In the United States, 1 in 10 people live in poverty, and many can't afford things like healthy foods, healthcare, and housing. The more these disparities are experienced, the lower the expected health outcome is. Those at high risk for having low literacy skills are typically older adults or adults who have a disability, lower income or unemployed. Maybe they did not finish high school or belong to a minority or ethnic group and have recently immigrated to the United States. Some of the greatest disparities in health literacy occur among racial and ethnic minority groups from different cultural backgrounds and those who do not speak English as a first language. Results from the National Assessment of Adult Literacy demonstrated that Hispanic adults have the lowest average health literacy scores of all racial and ethnic groups, followed by Black Americans and then by American Indian and Alaskan Natives. The percentage of Black adults who are not health literate is about twice the percentage of white adults at 22 versus 11%. And the percentage of Hispanic adults who are not health literate is about 3 times the percentage of white adults. Nonetheless, white adults make up about half, or 46%, of adults who are not digitally literate. Race and ethnicity play factors in the likeliness to utilize digital sources for health information. A 2019 study found that compared to whites, older Black adults and Hispanics were less likely to use technology to search the web for health information, use health management sites, and they were less likely to make or receive phone calls and use brain games for health. A higher proportion of residents of rural areas have lower health literacy than urban areas. This can be explained by differences in age, gender, race, ethnicity, education, and income between rural and urban populations. Rural residents experience a higher prevalence of substance abuse, smoking, obesity, cancer, diabetes, and heart disease, and rural residents have a higher proportion of injury-related deaths, including drug overdoses, vehicular fatalities, and youth suicide. Poverty is associated with increased negative health outcomes and worsened by increased barriers such as lack of transportation or lack of reliable internet access, or being underinsured or not having health insurance coverage at all. Public facilities such as libraries are essential in providing safe places to find and access health information in digital platforms. Users with limited literacy skills are likely to access the web on mobile devices. More than 90% own a cell phone. This was supported by the local librarians that we interviewed for this project. Most digital users of information are on their personal phone using the library's Wi-Fi. This poses all sorts of challenges depending on how you look at it. While they may be smaller and harder to navigate on websites, the amount of information presented at one time is shortened, which can make it easier for people with lower health literacy skills to comprehend. We also know that users with lower incomes, users with less education, and minority users are especially likely to access the internet primarily from their mobile phones, and they have an easier time learning the phone than a desktop computer. Recognizing communication barriers can help you direct patrons to the proper services. It is best to assume that all patrons seeking health information have low literacy skills. We can practice improvements that prioritize patient health literacy, such as introducing additional learning aids like visual aids to clarify questions and answers. Providers of information are encouraged to slow speech down and use plain language to communicate. The teach-back method is often recognized as a useful tool, asking the patient to repeat the information and instructions back to the provider, increasing comprehension. Avoiding yes or no questions will help encourage active feedback. Improving the digital health literacy of the general public can help to educate, inform, motivate, and empower individuals and families, and help them navigate and reduce the risk of participating in the online world. Thank you for joining us today as we discuss the barriers to digital health literacy skills. And for more information on this digital health literacy series, you can visit the LibGuides at Eastern Illinois University's Booth Library website.